nine, episode number 10. We're happy to be here with you all today. This show is brought to you by MedicareSchool.com. I can hear an echo pretty good. Okay, now we're good. This show is brought to you by MedicareSchool.com. My name is Joshua Music. This is my dad, Marvin Music, and we are excited to be here with you today. The goal of the show is really simple. We spent the last 15 years trying to educate people about Medicare through a lot of content and a lot of workshops. And then we just thought, well, what if we allowed people to be able to call in, ask their kind of specific questions and get some answers directly from myself and my dad. To kick this off, we're going to do a brief teaching today. That teaching will be about one of the myths of Medicare, and that is that Advantage plans are free. A lot of people, you may hear that. A lot of people talk about it, and there are definitely some free components to it, but Advantage plans are most definitely not free. And so we want to do a quick training on that, and then we will kind of open up the phone lines and be ready to take your call. A couple of reminders on that. If you want to be on the show, there's a phone number down here below at the bottom of the screen. Call in 833-824-2004. 833-824-2004. We're going to read some disclaimers. We're going to kind of talk you through it. One thing I do want to know is we'll scrub any personal information off the show, so you don't have to worry about that. We do want to hear from you, so feel free and feel safe and secure with that. If you have any general Medicare questions, we want to answer them. Any Social Security questions, or things about your personal situation, we have the ability to pull up prescription drug plans, pull up quotes on supplement plans, anything that you need. I think we're pretty well equipped. So, Dad,
all right,
hop into it.
Very good. Well, let's talk about this particular myth. It is true that sometimes people say, "Well, my Medicare Advantage plan doesn't cost me anything." Well, it's not true because first off, Medicare Advantage enrollments to be eligible, you do have to be enrolled in A and B. And so A has zero premium, but B always has a premium unless you qualify for state Medicaid. Most people don't. And so if you're on a Medicare Advantage plan, you have to be enrolled in A and B. So therefore, you're paying this year at least $202.90 a month for Medicare Part B. If you're considered to be high income, you're paying even more than that. So point is, there is a premium. Now, the reason a lot of people don't think about this is because that comes out of their Social Security check. And so because they don't see it in the check, it's coming out of the check, they just think there's no cost for that. So that's the first thing. There certainly is the B premium due for anyone enrolled in the Advantage plan. So when it comes to zero premium, what that means is that the insurance companies usually do not charge any premium for you to be on an Advantage plan. About 2 out of every 3 plans this year that are Advantage have zero premium. There are a few that have very low premiums, but we don't have to pay the insurance company a premium. And the reason for that is because instead of paying a premium, what we're going to do is we're going to pay as we go. It's a pay-as-you-go system. And so there will be a few items on all Advantage plans that could have a zero copay, usually a primary care doctor visit, basic lab work, those kinds of things are zero premium. But you're not going to see a specialist for free. Probably going to cost you anywhere from $25 to $50. You're not going to the hospital for free. Normally about $400 copay every day for up to maybe 5 to 7 days. If you have an outpatient surgery, it will not be free. It's going to probably cost you $300 to $400. An MRI is going to cost you $300. So the point is, you pay as you go. Now, we compare that to supplemental plans where you do pay a premium, but you don't pay much beyond that. And so those are the main 2 systems available. So with Advantage plans, they are not free. You pay the Part B premium, and then you pay copays. Now, the copays eventually will stop. We call that a max out of pocket. So I pay copay until I hit the annual max out of pocket. And that varies plan to plan. But on average, your HMO plans this year are going to be somewhere between about $4,000 to $6,000 max out of pocket. So if you have a $100,000 bill on an Advantage plan, you're not going to pay that, but you will meet that max somewhere between $4,000 to $6,000. If you're on a PPO plan, those right now are anywhere from about $5,000 to maybe $10,000 max out of pocket. And so it's a pay-as-you-go system until you hit the max. And then once we hit the max, if we ever do that year, then we're done paying for the rest of the year. And then in January, that plan will renew, and then the max out of pockets reset. So in January, we're back to copay until we hit the max out of pocket. All right. So definitely not free for some people, though. They're looking for a very low cost option on a monthly basis, meaning they just don't want to pay much of a premium at all. And so oftentimes they'll lean then towards the Advantage plan. Other people say, no, I'd rather kind of know what it's going to cost me. So they may like a supplemental plan to pay a premium, and then they don't have to pay as you go in that system. And as a company, we write both of them and certainly can take any questions about either one of those that you'd like to ask us today. All right, Josh.
Okay, awesome. Thank you. Okay, do we have a caller ready? Hi there.
Hi,
Hey, it's Josh Music and Marvin Music. Welcome to the show. Where are you calling from, and what's your name?
my name's Jeff from North Carolina.
Jeff from North Carolina. Welcome. What's your question?
Um, I'm going to sign up for Medicare in August, and I was wondering if I sign up for a G plan, and then later I want to switch to an M plan. Can I do that?
Okay. Well, North Carolina is a state where, in order to make that kind of a switch from a G to an N with most carriers, you would have to medically qualify to do that. There are a few states that wouldn't be necessary, but North Carolina at this point in time is not one of them. Where we're in Kansas and Missouri, where the home offices are the same way. So when we take a plan G, then if you do decide down the road you want to move to that N, we would have to go through the underwriting process. Now, what that means is we have to ask you some health questions, check your medications, and we submit that to the insurance company, and then they have the final say-so on that. So you don't have to be ready to run a marathon. You don't have to be perfectly healthy. But if there's some serious health issue going on, heart, lung, liver, kidney, serious diabetes, cancer, those kinds of things, probably not going to get you to move from a G to an N. But you probably, in those situations, if you can't qualify to make the move, you probably wouldn't want to move to an N anyways. Okay. So anyway, if you start with the G, I just went on Medicare in January. I have a G. I think N's are great options as well. Some states, there's a significant difference between the premiums. And so when that, that difference matters, we do know that the N plan can be a little bit more budget friendly, but they're both very good options. Okay. So hope that helps.
Thank you.
Yep.
Appreciate your call. Thanks so much.
I think for I think for all of our viewers out here, it's important to know we have G plans and all supplement plans have gone up quite a bit over the last probably 3 years, just as the whole Medicare market really has kind of reset itself. If you're on a G plan and want to find a way to save some premium dollars, call into our office, and we can kind of walk you through the differences between G and N, as well as give you some quotes. It's just we're seeing a lot of people right now switch from G to N just as simply as a way to save some premium dollars, and the coverage is pretty similar. It's not quite as good, but it's very similar.
Exactly. And also want to say, if you do want to make that switch, if you're in the midst of cancer treatment now, we can't get you approved. But don't feel like you have to be so perfectly healthy that you can't do it. And it doesn't cost you anything to try. And a call to our office is no cost to you, and the agents know pretty much whether we can get you through or not. We don't make the final decision, but we know what carriers are looking for. Some are particular about one area and not in another. So that's the beauty of working with a broker. We can try to find one that will actually approve you.
It's so yeah, 3, 4, 5 years ago, you'd make application for a new plan, and then you would have to wait for 2 weeks, 3 weeks, 4 weeks for that underwriter to review your file. Now everything is so automated, literally in a phone call, take 10 minutes, you will know if you qualify for a new plan or not. It's pretty nice.
Yeah, it is nice.
Okay, next caller. Hi there. Welcome to the show. Can you hear me?
Yes, I can.
Hi, I'm
How
doing well. What's your name and where are you from?
My name's John. I'm from Colorado.
John from Colorado.
Good to meet you, John.
What can we do for you,
Nice
sir?
to meet you. Well, I'm scheduled. Well, I turned 65 in July,
Okay.
and I am trying to get set up, try to figure out this whole Medicare thing, and it's quite confusing.
It is.
In addition to that, is I lost my health insurance. Well, I was on Medicaid or whatever it's called here in Colorado after I lost my job a few years back, and then I had some medical issues. I have type 2 diabetes. I'm on Farxiga and metformin,
Okay.
and I've lost that coverage, and I need to get some kind of bridge coverage before Medicare in July. But I also would like it to extend into the supplemental coverage, if that makes sense.
Mhm, mhm. Okay, well, if that's your only question, John, you're not going to be able to do that. There's not going to be any plan that will just automatically, turn into a Medicare supplemental plan. So what I would suggest, if you want some help with this, we'd be delighted to help you, and we can see if we can't come up with a transition policy to cover you for March, April, May, and June. Now, what date's your birthday in July, John? Are you taking Social Security benefits yet?
Yes, that's why I started that. I took early retirement back
Mhm, mhm.
a year ago in like May, and that's
Mhm.
why I lost my
That's your
Medicaid.
Medicaid. Yeah, I understand. Okay, so what's going to happen first off is your Medicare card is going to show up in the mail about the 20th of March. Automatically, anyone that's already enrolled in Social Security benefits will be enrolled into Medicare. So the card's going to show up in March, and what you can do is really anytime now we can help you. Get everything set up, for your coverage. So the transition policies, you only need it for 4 months, March, April, May, and June. So we can give some assistance there, and we will. And then at that same time, then we can talk to you about your different options for either supplemental plans in Colorado or Advantage plans. John, are you leaning one way or another right now? Full coverage, or do you even know the differences yet?
I don't even know the difference.
Okay.
I've tried to educate myself, but
That's
it's
all
very
right.
confusing.
It's all right. Let me encourage you. Listen, go to our website. It's medicareschool.com, and there's what we call an essentials workshop. It's about 50 minutes long. I did it, and the numbers change every year, so we always update that. But the 2026 version is on our website. It's going to take you 50 minutes, and I promise you're going to learn a lot. In fact, you're after watching that, you're going to have some good confidence, so you'll understand the Medicare system. And really, what it boils down to is if you would rather just pay a premium and pretty well be done, that's the supplemental coverage. Or if you don't want to pay much of a premium, just pay as you go. That's the Advantage plan. Now, I would tell you, I went with the supplemental plan because I like to have a plan that I don't have to deal with networks. I don't have to worry about the insurance company interfering with my doctor's recommendation. Those are the kind of things that happen on Advantage plans all the time: networks, pre-authorizations, annual plans, where we have a supplemental plan. I have a lifetime plan. So it can never be canceled by the insurance company. So my point is, you have to decide, how do you want your insurance to work? What do you want it to look like? And so that's what that workshop will teach you: the different types of Medicare plans. And then our agents can then go through and talk about pricing. Some people don't want to pay anything monthly, so that would be an Advantage plan. So we want to find the very best Advantage plan we can in your market. If you want to pay a premium, then we'll look at all the different supplemental plans and drug plans. But everything that you need, I promise you, we can take care of. So that's what I would do. Just give us a call. Let us teach you. But go to our website first and watch that workshop. I think you'll really learn everything you need to know to start making some good decisions.
Good. What's the website again? It's Medicare.
MedicareSchool.com is our website.
Okay.
And then you'll see on there, it'll say workshop. There's some buttons.
Yeah, up in the top right hand corner, there's going to be two links. That first link says free workshop. So click on that. You can put in your name, email, and it'll send it to you. You can watch it. It's about an hour long, maybe a little less. And then top right corner, it says get one-on-one assistance of that same website, medicareschool.com. And that's where you can schedule a time to chat with one of our agents. And it's free. There's no cost. Love to help you if we can.
Okay.
All right. Thank you so much for calling.
Take care, John.
Well,
Oh, go ahead.
okay. One quick question.
Mhm.
One quick question. I hear everything is that if you don't start this process 9 months or whatever ahead, then you're already too late and all that other stuff.
Not at all. 90 days is perfect. You're right in the target.
Yeah. And plus your Medicare enrollment's
Okay.
already taken care of for you because you're on Social Security. So you don't have to worry about that.
Yeah,
at
you
all.
do it 9 months in advance. The plans are going to probably change.
Yeah.
So no, you're right in the right ball.
Truly, 60 to 90 days is ideal. You're sitting good, John.
Okay.
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 All right.
Thanks, John. Take care. Okay, next caller. Let's go.
3, 2, 1.
Hi there. Welcome to the show. What's your name and where are you calling from? Yeah. Hi. What's your name? Where are you calling from?
April Llewellyn calling from California.
April.
All right.
Well, welcome. What can we do for you? How can we help?
I am turning 65 in the month of April,
Okay.
and am still working. So I wanted to know if I need to enroll in Medicare, or I don't need any benefits through Medicare, or how to enroll without selecting anything.
Yeah, if you are still working, you do not have to enroll in anything. There's kind of a myth out there that, people say, hey, if you don't enroll, you're going to be penalized. But if you think about it, it makes sense. Why would the government penalize you for staying on other health insurance? They would rather you work, for 30 years and never have to cover you. So the penalties start to come into play whenever you go without health insurance. So as long as you're working and covered by a group employer plan, is your employer over 20 people?
Yes.
Okay. And then if you don't mind my asking, about what do you pay for that on a monthly basis?
So like, I don't know, $120.
120 bucks. Okay. Yeah. And then what's your kind of maximum out of pocket? I mean, if everything went wrong.
My maximum out of pocket is 3,500.
Okay. Okay.
But then I have a flexible spending account for 3,500.
Oh, okay. Then yeah, you're you're gonna stay right where you are. Yeah, absolutely. I wouldn't do it. Don't let anyone talk you into picking up Medicare. It's not necessary.
Hey, April, one thing I would suggest though, let me ask you this: do you have a health savings account or just flexible spending only?
Just flexible spending.
Okay. Do you anticipate ever having a health savings account?
I don't. No.
Okay, good. Then what I would do is this: I would enroll in Medicare A only. It's smart to do that. And it's very simple to do. There's no cost. So all you have to have is an SSA.gov account, SSA.gov. And then okay, good. Then you go and enroll into Medicare. Now, when you do that, Chris, you're not enrolling into Social Security, and they're going to roll into Part B, just A only. So when you come to the place where it asks you, do you want Part B? Say no to that. Okay, there's no reason. Josh was right. The government's happy for you to not go on Medicare. And so just say no to B. And then when you do that, there's going to be a little flashing signal come up and say, are you sure you don't want Part B? You could be penalized. And it would be true if you weren't working, you could be penalized, but you will not be. So my point is take A only. And then what happens is that's the hospital side of Medicare. And so if you happen to go to the hospital, then you're going to give them your company plan and Medicare. And Medicare may pay something in the hospital. It pays co-insurance for people that have that, and most people do have some co-insurance. So that's why I would encourage you to get into A only. And then when you get ready to retire, about 3 to 4 months prior to retirement, then we can bring you into the B system. It's very simple. Just make sure you keep working or covered by a group plan until you retire. You'll have no problems at all coming in at a later date. All right. So that's an A only is what I'd recommend.
Got it. Thank you.
Oh, you're very welcome.
Thanks for
And
calling.
those of you that are watching right now, if you have an HSA, then you don't take A only. But if you don't have an HSA, A only is a really, really good move.
Guys, if you have questions of your own, please call in 833-824-2004. You're getting kind of an opportunity to speak directly to my dad and get his take on your situation. And so we just love to hear from you, love to connect. We get to learn from you guys what you're kind of facing out there in the Medicare landscape. So call in 823-824-2004. We're here every day, Monday to Thursday. Love to chat. Hello, welcome to the show. Hello.
Good morning.
Good morning. How are you? What's your name and where are you calling from?
My name is Phil,
Phil?
and I'm calling from La Quinta, California.
Beautiful area. I love that. Amazing.
It's nice and warm.
Yeah, I bet. It's not so nice and warm here. What's your questions? What can we do for you?
Well, I have several questions.
Okay.
Let's start with the basics. I know this is kind of silly, but I'm a little confused about this. What are the enrollment periods and what is the renewal period?
Can we ask a couple of questions about your situation just to contextualize it? Are you already on Medicare? Are you starting Medicare soon? Let me give me a little background. Already on, okay. How old are you?
I'm 69.
69, okay. And how long have you been on Medicare?
3 years.
3 years.
This is my 3rd year.
Okay, sounds good. And then as far as your coverage right now, I'm assuming you have Medicare Parts A, Medicare Part B. Do you have an Advantage plan? Do you have a supplemental plan?
I have a supplemental plan, a G.
Sub G. Okay, sounds good. And then I'm assuming you have a prescription drug plan as well.
That's correct.
Okay, awesome. So your question, so then let's rephrase your question in that context.
Okay, so basically, what I'm trying to figure out is when can I change my supplemental plan? Is it only around my birth date, or is it at a specific time of the year?
Okay, very good. Well, it just depends. If you're healthy and can get through underwriting, you can change a supplemental plan anytime. So when people have health issues that are fairly serious, then in the state of California, they have a birthday rule, which means around your birthday, I think it's 60 days, maybe 30 days before your birthday, 60 days after that window of time where you can move a supplemental plan. And California would be like to like or like to less. So if you're on a G, you can move to a G or to an N with no underwriting around your birthday. So when people call us and they have health problems, then again we're going to have to postpone that. But if they want to, shop and save money right now, as long as we can get through underwriting, then we do it ASAP. Because health could change, rates could change, and so we think it's wise, to make moves just as soon as you can. So when you ask about enrollment periods, um, are you concerned about, are you going to, do you feel like you want to stay on a supplemental plan, or do you think that you want to move off of that?
Well, I kind of like the supplemental plan,
Okay.
Plan G.
Yeah. Yeah.
But I was curious, in your opinion, what is more popular, the supplemental or the Advantage plan?
Yeah. Well, right now, about half of all of Americans are on Medicare Advantage plans. And they're probably popular just because of the low premiums. And people would rather sometimes pay as they go instead of paying a premium. Now, if you talk to people that have health problems, then Advantage plans are not popular. And this is the truth. Advantage plans are great when your care is simple and routine. But when people get into complex health situations, any kind of a chronic disease, they're going to have issues with their Advantage plan for sure. We will not get a single complaint on a supplemental plan all year long. We will get complaints regularly with people that have Advantage plans when they need to use them. If someone's healthy and they go to the doctor once or twice a year, then they're happy with their Advantage plan. They can go to the gym for free and maybe have get hearing aids or something, so they like some of the perks. But once people need their insurance, they quickly fall out of love with their Advantage plans. This just happened just recently. We had a gentleman that had a stroke, goes to a skilled nursing facility on an Advantage plan. After 13 days, the Advantage plan said, "We're not going to cover him anymore. Send him home." Guy was single, had no one to go home to. So they tried to find a home health care agency that would tend to him for rehab, and no one would take his Advantage plan. So that's a real problem. Had that person been in original Medicare with a supplemental plan, they never would have encountered that. They would have been in the skilled nursing facility probably 40, 45 days because, that system, original Medicare pays very well to the skilled nursing facilities. And now it's clinical evidence to decide when you're going to be discharged, not some insurance company algorithm saying after 13 days you should be recovered. So that's really what matters. And so my whole point is Advantage plans are popular, but they're popular for the wrong reasons. Low monthly premiums and perks. I just went on Medicare in January. I certainly went with the supplemental plan. So what happens when people, the kind of biggest drawback to an Advantage plan, and this would be in California as well, most states, if you're on an Advantage plan and you stay on that for a year or longer, and you want to get off of it, return to original Medicare, you have to medically qualify now to get a supplemental plan. And sometimes people roll the dice too long, and then they're stuck on their Advantage plan for the rest of their life. And that's very unfortunate. So, anyway, so as far as renewals go, your renewal on your supplemental plan is annual. It's not a calendar year. It's tied to the effective date of your policy. That renewals come up, price increases occur on an annual basis based upon when you took that policy out. And then, of course, in California with the birthday rule, you can switch those around your birthday, no underwriting. So, Phil, did that answer your question, sir?
Yes, it did.
Okay. Yeah.
And what is your most popular G plan?
you as far as carrier goes, insurance company?
Yes.
Yeah, it really varies state to state. We're brokers and we write for the majority of companies, so there truly is no proper one. You know, I will tell you, there's a couple of companies that we shy away from. We would write for them if someone said that's who I want, but we'll shy away from them because we have not seen good stable rates. We are also we're very cautious when a company is new to the market. Not saying we wouldn't write them, but we're cautious because we know sometimes a company will come in and they're trying to see if they can get foothold and really get established in the med sub business. They don't make it. Also, is a great example of this. Just recently, came in. Of course, they're a well-known company, but they could not capture enough market share to make it work. And so when that happens, those companies, you know, people lose their policies, but that group is very small and they're not going to be very stable with their rates. So we look at carriers that are national, carriers that have good market share, because we believe that they're going to have more people in their group, which means the risk is spread out to more policyholders, which net effect to you would be stable rates. And I promise you, it just varies across the country. We'll have companies that will be they will like a certain area. They'll be very aggressive with their pricing because they like that area. And that's fine. We're good with that because a lot of people are going to buy that plan in that area. So they'll probably be very stable. So that's varies throughout the country. I'm not trying to avoid your question, but there is no blanket. Here's the best. It doesn't work like that for sure.
Sure. And I have seen the rate increases over the last couple of years.
Yes, sir.
So that's why I was interested possibly in changing my G plan.
The other advantage of, you know, changing is you will enter, you know, by leaving, you know, you've been in this block of business, for lack of a better term, for the last 3 years. By switching now, you would be entering into a new block of business, a new risk pool, with presumably younger, healthier people. So you're going to save some premium dollars almost assuredly, and you're going to enter a block of business that's filled up with probably younger people, the people that are coming on Medicare right now that are 3 or 4, 5 years younger than you. And so generally what happens is you kind of get to reset that risk pool. And a lot of people that are in the pool of people that you're in that block of business, they are going to be switching over the next couple of years. And so what ends up happening is all of the healthy people that can switch across the country are switching into better risk pools or, you know, groups of younger people, and all of the people who can't switch due to medical qualification end up getting stuck on those plans. And so those premiums start to go up a little bit faster. So we recommend people review their coverage every 2, 3, 4, 5 years, make a switch. We're not, kind of set it and forget it for forever. See if there's ways you can save money and get into a new risk pool.
Yeah. I want to add this too, Phil, and for really anyone that's curious, if you are on a supplemental plan and would want to go to an advantage plan, you can only do that once a year. And we're beyond that period of time right now. So someone on a sup moves to advantage, they have to do that October 15th through December 7th. And then their sup takes us through the end of the year. Advantage plan starts in January 1. So the point is, if you ever wanted to, look at advantage as an option, that's the only time you can make that switch.
Okay, I have another question for you.
Yes, sir.
Well, actually, I have several. How do you compare Schedule D plans?
Okay.
How do you compare them? So you can go to, so it used to be this world has changed the last 3 years. As brokers, we used to be very, very involved in like setting up prescription drug plans. The last couple of years, most of the insurance carriers have kind of taken away our ability to represent and write those plans for customers. So what we recommend people to do now is truly just go to Medicare.gov. They've got a great drug plan finder tool. So you just go to Medicare.gov, put in your medications, put in your zip code, and choose your pharmacy, and then literally the plan that is up at the very top of the screen is probably the plan that's going to be the most cost effective for you. What's your zip code? Do you take medications or not?
Yes.
Okay. What drug plan are you on? Do you know?
First of all, I was on United Healthcare.
Sure. Yeah, those
then-
plans got pretty poor.
Yeah, that really went through the roof.
Oh, yeah.
First of all, it was ridiculous. It was like $80 a month for me and my wife,
Yep.
well, for both of us.
Yep.
And then went up to over $100 a month, and I switched, and it went down to $4 for my wife
Yeah.
and for me.
So you're on either Cigna or WellCare, probably. Either of those sound right? WellCare. Yeah, a lot of people
Yeah.
on WellCare. Yeah, so you can't do anything right now, but come October, go to Medicare.gov. We always put out a bunch of resources on how to do this, and literally should take you 10 minutes just to double check, make sure you're on the right plan. If if a different plan pops up, click enroll. It's very easy to do
Yeah.
drug plans now.
Yeah, and when you put your meds in there, it'll show your present plan where it is, and it still may be number one. And if it is, you stay on it. Drug plans will automatically renew. But let's say you're on WellCare this year, it's number one, and next year it's 3 or 4 of 10 plans. Then we would always recommend switching. Because honestly, there is not a big difference in the quality of service you're going to get. What matters are your medications covered in the formulary, and you want to get the very, very best price possible. And that's what that lookup tool is doing for you. It's analyzing based on your pharmacy and your meds. It'll put them all in order of really best worst as far as coverage and cost. So it really is a good tool. So just do it on your basis. Go ahead.
No, go ahead.
No, you're fine, Phil.
I didn't realize, I knew I could do it for the supplemental plans. I just didn't know that I could do it for the D plan.
Yeah, the comparing supplement plans on Medicare.gov is kind of fraught with a lot of it's not the best way to do it for sure. There's a lot of great classes that end up getting mixed up in there, confuses a lot of people. So you can look at there's some basic info. But the drug plans, I mean, that's the powerhouse for Medicare.gov. I feel like that's the best, easiest resource. You can trust it. It's clean. It's clear.
Yeah, for med subs, there's no really real accurate information that's supplied by the insurance companies, but we find the drug plans to be pretty accurate in Medicare.gov.
All right, let me ask you another question then. So you said that in California, there's this thing around the birthdays, your birthday. I think it's 60 days after, and did you say it was 30 days before?
Well, what I was saying is I think that's what it is. There's about a dozen birthday rule states, so I don't have them all memorized, but I know it's around your birthday, and I was thinking it was 30 days before and 60 days after. But Josh is going to look at it real quickly. It varies state to state. So
yeah, 60-day period begins on your birthday.
Yeah, so it's from your birthday to the next 60 days.
Okay.
Yeah.
That's very helpful.
Yeah.
It's for both D and G.
No, sir. No, just your supplemental plans. The only time you can change drug plans, Phil, is October 15th through December 7th. We call that the annual enrollment period. So we switch drug plans during that time and Advantage plans. Supplemental plans can be switched any time of the year. We just have to go through underwriting other than that 60 days around your birthday. So the birthday rule is SUPs only.
Yeah, see, I tried to change my supplemental plan in the October 15th through December 7th period. And they said, oh, no, you got to go through underwriting or else you can wait till your birthday. So,
Yeah, and that's correct. But the October 15th to December 7th, that's the drug plan time.
Yeah.
It's confusing.
I'm sorry. Yes. Okay, gotcha.
Good.
I have another question for you. Why would I want to use a broker if I can have all access to all of this information?
Well, Josh can chime in on this as well, but from our angle, number one, to use our services is zero cost. So it doesn't cost you anything at all to have a broker that will assist you. If you go directly to the insurance company, they're not going to compare anything for you, Phil. You're going to have to call United Healthcare. You're going to have to call Mutual of Omaha. You're going to have to call Aetna. You're going to have to call Cigna. So you have to call all these carriers to be able to really get reliable information to compare prices. You call a broker, us, or whoever you use. It's one phone call. We write for the carrier, so we can make that comparison. Also, you're just truly a number if you go directly to a carrier. I mean, they're glad to take your premium, but they're not going to answer your questions. They're not there to do that. They're the insurance company. They're going to process claims, pay bills. But as far as giving you advice and doing what we're doing, you never get this from an insurance company because that's not their business. So you become a client of a broker, and that broker hopefully cares about you enough to keep you up to date, make sure that you know what your best options are. People can call in our company that are our clients, and we'll check anything they want. I had a guy call today. It's having a difficulty with his IRMA, and I'm going to help him with that. You can't call any insurance company and ever get any help with IRMA. I called Social Security for him this morning. Was on hold trying to get to someone to answer a question. So you're not going to get that kind of service with an insurance company. It's just not what they do. And then, so what does it cost you to use us? Nothing. The insurance companies pay us. So let's say that you have a carrier that's going to charge you $180 for a premium. That's exactly the same price we're going to quote you. We all quote the same prices because the insurance companies set that price. And so what they're going to do is they're actually going to pay us a commission as your broker. We become what's called the agent of record. And any problem you have, we can actually get involved and help you with that.
Yeah, we have a customer service team, so we bring on, a new customer like yourself. You're going to first talk with kind of our what we call a Medicare guide. It's our kind of a licensed agent, licensed and broker here on our team. They're going to pass you off to an onboarding team, a new business team, to make sure that every single thing, every I has been dotted, every T has been crossed. Your premiums, you got your cards, any kind of first questions you have are answered, and then you actually will be assigned a long-term client service team member, one person that you are able to connect with on anything that you have a problem with. So you can actually get to know this person and they're going to take care of you. If you move, you need to change plans. If you need to change supplement plans down the road, switch to an advantage plan. If you have a billings, a claim issue, anything like that, we are able to get involved on your behalf. So the answer to your question is no, you don't have to use us. You can go direct to the insurance carrier. I know when I buy home and auto insurance, I have a broker because I don't want to call 8 different insurance carriers and quote it. I just want to call a guy, and the guy's like, "No, you're on the right plan." And if there's an issue with it, they can, kind of get involved and assist. But thank you. We got to get to our next caller, but it was wonderful chatting with you. If we can help you, we've got about 100 people here on the team every day that come to work just wanting to help people with Medicare things. So make sure you're on the right coverage. Thank you.
Yeah, good talk to you, Phil. Thank you, sir.
Hi there. Welcome to the show. What's your name and where are you calling from?
I'm Joanne, and I'm calling from Seattle.
Joanne from Seattle. Welcome. What questions do you have?
No, I have registered for VA healthcare, and at this time I have an Advantage plan as well, and I'm just wondering if I should keep this Advantage plan. I don't know enough about the VA healthcare system to quite make that decision. So can you help me with that?
Yeah, a couple of questions. How old are you?
71.
71. How long have you been on this Advantage? Yeah, I guess the VA and this Advantage plan.
Advantage plan, I had to change Advantage providers this year, but I've been on it for 3 or 4 years, I guess.
What
And I
carrier are you with?
What Advantage plan?
Yes. Yeah. What company are you with?
The U.S. Healthcare, and I haven't been with them only since January, so I don't have much experience with them either.
Sure. What's your zip code, real quick? I just want to pull that plan up so we can talk intelligently.
98199.
Okay.
And I was compelled to do that because my provider's system no longer accepted Humana, which is what I was on, which seemed to be a nice enough plan.
Okay.
So either I had to change.
And are you on? What's the plan called?
US.
It's AARP.
Okay.
United Healthcare.
Okay. United Healthcare. Okay.
Go ahead. Okay. I just want to find out, Joanne. So what is it that triggered you getting VA eligibility? What happened?
Well, I'm not my experience with United Healthcare, although brief, is not the best. So I'm actually looking for the VA to be more comprehensive and less costly, and could have done this years ago, but I didn't.
Okay. Did you serve in the military, or a spouse did?
Yes,
You did?
no, I did.
Okay, very good.
Mhm.
That's great. And so, are you getting some kind of a disability through the VA? Are you 100% VA or 50%? What's your status with them, if you don't mind?
Well, no, because I've just registered, and um, I I'm assuming that I'm going to have to go through some process to obtain any disability component.
Yeah.
So I don't really know. I'm sorry to be so
And that-
uninformed, but
No, it's all right. You just started the process, but you know for sure you're eligible. Have they issued you like a VA number yet?
I don't have a number, but I'm scheduling an appointment.
Okay.
So for a healthcare team, so I've been accepted into the program. I know that.
Okay. Sounds good. Well, let me ask you this. On that Advantage plan that you're on right now, does it also have a prescription drug plan built within it?
It does.
Okay. I figured it did. And so you can take it back then. Okay, John, what I'd recommend, once you've been approved on the VA system, and you may already be approved, but usually they give you some kind of an ID, and there's some type of like a member ID number within the VA system. So what I'd recommend doing once you have that number is you actually can change your Advantage plan, and this would make sense financially for you. Because what happens is Medicare Advantage actually comes in two different ways. We can get Medicare Advantage with prescription drug coverage, or we can do a Medicare Advantage without prescription drug coverage. Now, the only people that could ever do Medicare Advantage without prescription drug coverage would be those that can get their meds through the VA, like you're going to be able to, or TRICARE, which is retired military, or those that are retired from the civil service. They retired, from the IRS or Homeland Security or something. That's called FEHB. So those three groups of people can wisely get an MA only plan, Medicare Advantage only, get their prescriptions, VA, TRICARE, or FHB. And when you do that, Joanne, what will happen is that you can change your Medicare Advantage plan, get off of the one where they cover meds to get on one that doesn't cover meds. And then that Medicare Advantage company then can take some of that money they get from the government monthly, and they actually can give that back to you, and that money would be credited towards your Social Security check.
Yeah. So like there's a plan that we would probably recommend called a Patriot plan. And a lot of these plans have some sort of like military themed name. And so I'm not recommending 100% this plan for you, but like for instance, there's one in your zip code that's called the Patriot plan. And they will actually take about $1,300 a year and about $105 a month and put that right back in your Social Security check.
Right.
And you may have heard of things like that, but now that you have the VA benefits, and then these plans are built literally specifically for people who are retired military as a way to coordinate and then kind of give that back. And so it's a benefit you qualify for that not many people do.
Yeah. So that'd be something that if I were to look at. Go ahead.
My question is, do I need an Advantage plan at all?
Well, let me tell you, no, you don't. However, here's the issue with that. You're already enrolled in A and B, so you're already paying, your Part B premium. So what I would do is I would take advantage of some of those benefits by staying in the Medicare system, because you get VA because you served in the military. Totally different system. If you have your Medicare Advantage only plan, you're getting that because you paid into the Medicare tax system. And so to me, that gives you a wonderful civilian option. So let's say if you're traveling and you found yourself in a situation where you needed care, well, you can go to any emergency room in the country. You can go to any urgent care on your Advantage plan, and it's going to cover that. Now, VA can cover that, but it may be a little bit more complicated. So my point is, do you need it? No. But is it wise to have it? Yes, because now you have a civilian option. You have, let's say VA wants to do a certain thing and you're not positive about that. Now you can use your Advantage plan to go get a second opinion about that. Is that something you really want to do? and they're just two totally different systems. VA is not going to bill the Medicare Advantage, and Medicare Advantage is not going to pay the VA anything. They're two totally different insurances that would be available to you. So to me, you're paying your B premium anyways. Why don't you take advantage of it? The VA is not going to offer you a gym membership. They're not going to offer you a dental allowance. They're not going to cover hearing aids, probably. My point is, you have these different additional benefits that come with the Advantage plan that you cannot get through the VA system.
Okay, okay. And the amount that I get back from doing like a Patriot plan is what I am paying for the Advantage plan right now.
No, well, of course,
China?
Do you pay a premium for your Advantage plan?
yeah.
No,
Yeah.
no, I don't.
No, it's what it's doing is kind of like reducing your Medicare Part B premium. So Medicare Part B premium is a little over $200, 203 or whatever.
290, right?
Yeah, 203. So basically, they're saying, hey, we're going to take half of that. We're going to give that a credit towards your Social Security check.
That's right.
Yeah.
Yeah, very nice benefit. And why? Because they don't have to pay for your meds. The VA is going to do that, and VA is credible coverage. So it really is a win-win situation.
Yeah. And like this Patriot plan is dental coverage and vision coverage, all those extra things that, you're not going to get through the VA. So there's not really a reason not to do it, I guess.
Yeah.
How do I find a Patriot plan then?
We can take your information and have somebody reach out to you, but let me also give you
We can send her a text.
we're going to send you a
We can
text.
send,
Yeah.
we can send you a text, Joanne, and you can open that text up and actually set up an appointment to talk with one of our agents.
And then they're going to be really experienced on these types of plans because we do it just every single day. And our services are free to you. It don't cost you anything to work with us. But hopefully we can provide you some good value.
What benefit do you get out of it? Does VA
Well,
pay you?
no, we're health insurance brokers, right? We help people with Medicare plans. So as a broker, we are paid for servicing you, for helping you as the years go by. But we're paid by the insurance carriers. So there's no extra cost or upcharge. We're a free service to you. And hopefully it's something that's valuable by pointing you always in the right direction, because plans change, life changes, as you know. And so our job is to kind of stay up to date and be expert on what is available in your area. Just like you may have a home or auto broker who knows what's going on in your marketplace, we essentially serve that function as well.
In my situation, then it is beneficial for me to have the VA component.
Oh, absolutely. Yeah, absolutely. Yeah, I think it's wonderful.
Okay.
And once you have your VA ID number, we can move forward on one of these MA only plans. And happy to do that. I mean, I think you'll be thrilled with it.
They have a number. They sent me a giant booklet that is like impossible to go through. So
you
that
probably
may be
do.
where the numbers hidden.
Yeah.
Yeah. Okay.
Yeah,
Very
that's-
cool.
That's all you would need, and we'll send you that text, and you can set that up, and we'll help you with it, Joanne. And like Josh said, there's no cost at all. We're paid by the insurance company. We'd be thrilled to help you.
Of course, we've all heard bad rumors about the VA in terms of timeliness. Do they contract out with private vendors as well for people that maybe it's way backed up and they can't be seen or something like that? I mean,
Yeah,
are there those kinds of options? I don't know about the VA so
Yeah.
much.
Yes, they do. They try to make sure you can get care, adequate care, and timely care. And so they're definitely working. I wouldn't say it's a perfect system, but I think they really have worked hard to improve that. But you also have in your back pocket this, if you do this Medicare Advantage plan, you wouldn't even have to be concerned about that anyways. Okay, so use the because
I couldn't, I
because
couldn't go to a specialist or anything, could I? I could just get dental and stuff, right?
No. You're going to have the best of both worlds,
Mhm. Yeah.
right? You're going to have the VA and you're going to have the ability to go civilian
Yeah.
as well.
That's the way I look at it.
You're just going to continue. You're going to get your drugs to the VA, which is a great thing,
Mhm.
right?
Right. But like for instance, if you had your Advantage plan and you had a special visit, was probably a $30-$40 copay. But yeah, and it's a PPO plan too. So you'll have lots of doctor options outside the VA system. So that's what I'm saying to you. I think you have the best of both worlds. You have good options. Use the VA when you want to. And if you don't want to, don't have to. You have a sinus infection, you don't want the hassle of of going down to VA and just find a local doctor.
Urgent care, whatever.
Yeah, go to urgent care. That's true. That's why most people like this option.
Oh, cool.
Yeah.
All right.
Okay.
Well, okay. So take my info.
Okay.
Yeah. We'll send you a text.
Yeah, we'll send you a text for sure. And Joanne, thanks for
Oh,
calling.
okay.
Yeah, sure. Good to meet you.
Thank you.
Thank you. It's
Take care.
it's been puzzling in this whole process. So I thank you for clarifying things.
You're welcome. We'll be here for you. Thanks.
Hello. Welcome to the show. What is your name and where are you calling from?
My name is Mebrudin. I am calling from Frisco, Texas.
Oh, from Frisco, Texas.
Okay.
What questions do you have?
My question is about the Medicare supplemental plan.
Okay.
I am on Social Security. I'm 65 years old in September. And when will be the best time that I buy supplemental plan and the plan G and plan D? And how much will be cost in Texas if they know?
Sure.
What's your zip code? Okay, I'll let you kind of do that and I'll pull something.
Okay, so very good. Well, first off, yeah, Josh is going to pull up some rates. So you said you are on Social Security, is that correct?
Yes, I am on Social Security from
And your date of birth is what, September what? Okay, that sounds great. So what's going to happen is first off, your Medicare card is going to show up in the mail around the 20th of May. 20th of May, it will show up. Okay. Anyone that's already enrolled into Social Security, retirement benefits, spousal benefits, survivor benefits, is automatically enrolled into Medicare A and B at 65. Card shows up in the mail. So be sure to be looking for that around the 15th or 20th of the month of May. And so, yeah, so it'll show up. And then what you can do, in fact, you can even do this now, if you want to, we'll give you some kind of a general range of different carriers. We write for about 10 carriers in your area. So we'll give you a range for premiums. And in Texas, we actually can enroll supplemental plans 6 months in advance. Now, your supplemental plan is not going to start until September 1 when your A and B goes into effect, but you can actually enroll in those plans as early as 6 months. So if you want to talk about that, we can. Also, we can help you and give you some good direction for your drug plan. Drug plans are already out for the whole year, so there's not going to be new ones introduced between now and then. So we can actually talk about that as well. So anything you need as far as the stops, whether you want to do a G plan or an N plan, we can help with that.
Yeah.
Okay. And Josh,
Let me just give you some rate. Are you familiar on the differences between like a plan G and a plan N?
Yes, I am. I am watching you guys for about years. I'm watching Marvin.
Excellent. Thank you for watching us.
Yeah, I am doing that. I was watching today too.
Okay, awesome. Well, thank you for watching us. So I plugged in the information that you gave me. You're going to get a plan G for somewhere around 160 all the way up to $220. So remember, a plan G is a G is a G is a G. It doesn't matter what carrier you purchase it from. They're going to have about the same. They're going to have the same coverage, right? And the only thing that's going to matter or change is those rates. And so, when you call in, we'll walk through the actual carriers with you, but no, 160 on the high side, or on the low side, and then maybe up to 180, 190, depending on which carrier you like. Now, plan N, we can get down as low as probably 105, 110, somewhere in that neighborhood.
No, I will definitely go for the plan G.
Okay, plan G. Okay, wonderful. So so figure that 160 on the low end for a plan G there in your zip code in Texas. Yeah, and there could be additional discounts, if you have.
Are you married?
I'm married. Yes.
Okay, is your wife above the age of 50?
Yes, she's 58. Yes.
Okay, very good. Good. So then you qualify for what we call a household discount. She didn't have to be on, of course, she's not on Medicare yet anyways, but she didn't have to be on Medicare. It just means that you're either married or live with someone. They give you an additional discount. And then when she gets ready to go on Medicare, you can even get a little bit of a deeper discount by being with the same company.
Yeah, so we can get a plan G maybe down as low as 150. So,
Yeah.
knocks a little bit
off. Mm-hmm.
Thank you.
Yes. Yeah, I live in Missouri, just so you know, and my G plan is $212 a month. So Missouri is kind of a higher state. Certain rules that exist in Missouri that drive the price up, but I went with the G also. So I think you're making a good decision. And if you went with an N, I think it's still a fine decision for sure. They're both really wonderful. So good for you. And I'm glad we met you through the YouTube channel. Is there anything else that we need to talk about? Because we don't want to let you go unless all your questions are answered.
Yes, I like it because I have my medical coverage. My wife, she worked for Walmart.
Okay.
But when I receive my A and B card from Social Security, when I purchase, probably I will go with you guys as you do that for me, that you help me that, and I like to know when start that coverage when I take the supplement G.
Uh-huh.
When starting that I know that my wife can take me off from that.
Yep.
That's
Because this
correct.
year, yeah,
And-
that can you help me that? And I wanted a prescription plan D that I have in future. You never know what can happen. I'd like to have that one. I am not sick. I am in good condition right now. I don't go to doctor. I don't use the medication. I just to have to it happen that I can buy the brand.
Yeah.
brand prescription.
Let me look up one thing real quick. So we can go to Medicare.gov and kind of look at the drug plan situation real quick. 75035. Is that what you said?
Yes.
Okay.
Yes.
Just if you don't take any medications, generally what we're going to recommend is the lowest cost plan. And so there's a WellCare Classic plan. It's $0 in monthly premium. Now that could change every year. It could go up to $5 or $10, in 2027. But that WellCare Classic plan, zero premium, is probably the plan that we would recommend you go on. So if I were in your shoes, you start in September. When's probably the best time to get in touch with us, Dad?
Really, anytime. What let's do this. We'll send you a text so you'll know how to be able to set up an appointment. So anytime you'd like to, you're fine. Your card's going to show up in May. So
Yeah.
that would be perfect
When you have that Medicare
the
number.
Medicare number. That's what I would do. That 90-day window is really ideal. So we can send that to you, and then you can go online, set an appointment up, or just call in, and you'll be able to talk to one of our guides. But May would be ideal. That's really the best time, and nothing's going to change much between now and then for sure. And then what you're going to do is you're going to tell your wife to let Walmart know to drop you effective September 1. She doesn't have to pay any more premium beyond that. So it's your birth month that you'll begin.
I'm not sure if she do that because she paid for
Yes.
starting.
Yes, she can. Yes,
in January.
Yeah, she can because you have a life-changing event. You have the right to go on Medicare, and therefore she has the right to drop you from her group plan. Yeah, they won't give her
Yeah, and
any problem.
the employer wants you off, so they're gonna let you off.
I appreciate you for that. Thank you so much.
Yeah.
Thank you
Hey,
so
thank you. Nice to chat with you. Look forward to helping you. Thank you.
much. Okay, I appreciate so much. Thank you.
Yeah, take care. Good talking to you.
Okay, hey, that's it for today. Thank you all for joining us. We'll be back here tomorrow, taking more of your calls, doing some more Medicare education. If you want to be on the show tomorrow, give us a call, 833-824-2004. We would love to be able to help you. And if you need help setting up your plans, if you want to talk to one of the people on our team, they're all licensed insurance brokers who can compare all of the options, help you really navigate and figure out what's best for your situation, and even get you signed up and enrolled so that you can stop worrying about Medicare. Our phone number is 833-833-3661. So I'm going to say that again. You can write that down, 833-833-3661. That doesn't get you to the show. It gets you directly into our office to be able to schedule an appointment to talk with someone on our team. So thank you. We'll see you tomorrow.